Hi, I'm Dr. Kelly Harding at Columbia University Medical Center. I'm joined today with Dr. Arthur Barsky of Harvard Medical School and Dr. Brian Fallon of Columbia's College of Physicians and Surgeons. Today we're doing a series of segments on hypochondriasis. And now we'd like to talk about the treatment study that's going on at both of the sites for hypochondria. If you could tell me more about that.
Okay, maybe I'll start. This is a NIH-funded study. The National Institute of Health has funded this study because hypochondria is recognized as a huge problem affecting a large portion of the population, and it's actually a disease that is very understudied. So the National Institute of Health, in their wisdom, agreed that we should really try to understand what's the best treatment for people with hypochondriasis. Now, in my early research in hypochondriasis, took a look at the facts that it seemed as if there were a lot of obsessional features to these hypochondriacs. That is, they have this thought, they worry about illness, they can't get it out of their head, it's intrusive, it's there, they don't want it to be there, but over and over again they worry about illness. And then they feel compelled to check. So they check with doctors, friends, their bodies, the internet. So in the worries about illness, the intrusive worries, and the compulsions to check, they look like someone with obsessive compulsive problems. And I had worked with OCD, and so I thought, well, let's try to see if some of the treatments that help patients with obsessive compulsive disorder might help people with hypochondria. And those early studies looked great. We had roughly 70% of people benefiting significantly from treatment with the medicines called serotonin reuptake inhibitors. And standard medicines that are known in the trade by their trade names would be Prozac and Luvox and Zoloft and Paxil. Those all seem to be helpful when you give them at the right levels and the right dosages for an appropriately long period of time. People can get dramatically better. So we've sort of pioneered, in some senses, the pharmacologic treatment of hypochondria. My colleague, Dr. Barsky here, is one of the world pioneers in the cognitive approach to hypochondria. So maybe you could talk a little bit about that.
Yeah, I mean, basically our idea was that, in fact, we talked about this in some of the earlier segments, is that a major part of the problem here is the way in which hypochondriacal people think about disease, the way they understand their symptoms, what they know about medical care. And so we thought that if we could really work on those thoughts, there are some of their mistaken assumptions, some of their beliefs that are incorrect, and people could really learn to develop some sense of control over their worries and over the symptoms. And so there's a cognitive behavioral strategy that basically teaches people some techniques, some skills that they can learn to both turn down the volume of their symptoms and also get much better control over their anxiety and their worry. And like Dr. Fallon, we've done a couple studies prior to the current study that suggested that these approaches were in fact beneficial for people. And so the logical thing to do was to get together and do a study in which we looked at the two different treatments, compared them, see how they do together, because probably it's not one size fits all. Some people are going to do better with a medication. Some people are going to do better learning cognitive behavioral techniques. And it's very critical to find out who is going to do better with which treatment. And the other question that we're looking at in this study is whether giving both treatments together is actually more powerful than either one of them alone.
If someone were interested in the study, how would they find out more about it or to see if they're eligible?
Well, they could call the Columbia site, or they could call the Boston site, Dr. Barsky's group in Boston, or my group here at Columbia. Our contact phone number is 212-543-5542. Arthur, what's your contact number?
The phone number up in Boston is 617-732-5969 for the study. And then we also have both of us have websites.
And you want to give the website address?
Ours is www.thehealthstudy.com.
And ours, Kelly, you know it better than I.
It's illnessworry.cumc.columbia.edu.
And those are really helpful websites because they give you all the information about the study.